And on the heels of our Advanced Radiation Pivotal Performer Award, we remind you that this month is Prostate Cancer Awareness Month, and our Kenny Singleton talked about the importance of getting screened with Dr. Deepak Kapoor.
Hi everybody, this is Ken Singleton reminding you that September is Prostate Cancer Awareness Month. And joining us now is Dr. Deepak Kapoor. And Dr. Kapoor, first of all, thanks for being with us. I know you have quite a few questions. I have the questions that you can answer and help us out with understanding how we can deal with prostate cancer. Now, how big an issue is it in the United States?
Well, first of all, thanks for having me out here and helping raise awareness for this important issue. Prostate cancer is a real problem in the United States. It's the #1 cancer diagnosed, and it's the second leading cause of cancer death in men. 1 out of every 6 men is going to get prostate cancer during their life, and even now, with all the advances that we have, 1 man dies every 30 minutes of this disease. If you have a family history of prostate cancer or African American, the risk of getting the disease and dying from it is even higher than that.
Now, what are the signs of the disease, doctor?
Well, that's one of the real problems that we have. There are no signs or symptoms of prostate cancer. In fact, you can put it like the most common symptom of prostate cancer is no symptoms whatsoever. The only way that you can detect prostate cancer is to prospectively look for it.
Now, how do you get tested?
Well, testing for prostate cancer is very easy. There's a simple blood test and a physical examination. No man likes to think about having the physical exam, but it's a necessary part of being a guy. Women go ahead and have their mammograms and get their pap smears done. For us as men, we should do no less to go ahead and take care of our own bodies.
Now, how often would you suggest that you get tested?
Well, the American Urological Association recommends that for African Americans and for patients who have a family history of the disease, that they start getting checked at age 40. For everybody else, annual screening. You should talk to your doctor about annual screening around age 50.
Age 50. Well, I'm certainly there, and I've had been checked for prostate cancer and colonoscopies too. That's very important as well.
Absolutely. Anything that we can do to go ahead and proactively look for disease when it's early. For example, as you mentioned with prostate cancer, when I was a resident, the incidence of finding patients with advanced disease was very high. That's gone down by 75% with early detection. 20 years ago, the 10-year survival for prostate cancer was 53%. Now it's 99%. The bottom line is that early detection saves lives.
Now, I understand you have an event coming up to bring out the awareness for prostate cancer?
That's right. There's screenings throughout the New York metropolitan area, as well as a number of events to raise awareness. The Integrated Medical Foundation, which is a not-for-profit organization that supports prostate cancer screening and awareness, is having a Wear Blue event. So on September 26th, we're encouraging everybody to go ahead and wear blue. Like we've got our little pins on today to wear blue for the men you love. Baseball is one of those games that's handed down from generation to generation. It's important for men to go ahead and get themselves checked so they can go ahead and be there to pass this game on to their children and grandchildren.
Kenny, Dr. Kapoor, thank you very much. And if you want to set up a screening, you could head over to Advanced Urology Centers of New York's website, www.advancedurologycentersofnewyork.com. Bobby Richardson.